Hi everyone, it's Neil here, also known as the Wax Whisperer. I hope everyone is keeping well and safe. For anyone who doesn't know who I am, I'm a UK-based award-winning consultant audiologist and clinical ear care specialist, and I specialise in the diagnosis, treatment and rehabilitation of people suffering from hearing loss and balance issues, as well as the clearance of impacted earwax and infectious discharge from the ear canal. We have a client here who attended with bilateral, very hard, almost stone-like earwax, impacted very deep in his ear canal. He was not only suffering from earache and itchy ears, but also reduced hearing. He denies using cotton buds, but I've been doing this job long enough now to realise that he had actually impacted us using cotton buds. The earwaxes, again, it was very hard, very impacted, boulder-like. I initially tried a suction probe, but as soon as I put a bit of pressure onto the wax, he could feel that compressing against his eardrum. So I then went in with an ear hook and I managed to remove the large piece of earwax initially using the ear hook. This remaining piece of wax, it's very medial, adjacent to the eardrum, and it's always far safer to try and use suction to remove that. If you use other instruments like ear hooks or Jobson horns, you're more likely to become in contact with the canal wall. And if you've been watching some of my videos and listening to my narrations, the inner 2/3 of the ear canal is very sensitive. It's basically a very, very thin sheet of skin directly over the bone, whereas the outer third, it's made up of cartilage and you've got fatty tissue there, which can provide some buffering, some comfort. So managed to remove that. You would have seen the ear canal was very dry. Now that could be because the client is suffering from something called otitis externa. Otitis externa is almost like eczema of the ear canal, and it can cause irritation, itchiness. It can also sometimes lead to discharge, what we call otorrhea. So otorrhea is the name of the pus or discharge that's secreted in the ear canal. It may also be due to the wax itself, because the wax is so hard and dry, it's quite coarse, and when the patient talks and he chews, it could be that the wax is almost grinding against the ear canal wall, causing it to become very dry and itchy. So we've told the client to monitor how he feels. If his ears are still itchy in a few days, to contact me and I can advise him to visit his GP and receive some treatment for that. And you saw there, I initially tried to use an ear hook to remove the wax, dislodge it, but the client actually found it a bit uncomfortable because it was making contact with the bony canal wall. So I reverted to the suction probe there, and I managed to wriggle it from the superior part, and it came out in one big piece. There's a bit of remaining wax on the anterior canal wall. So when I say anterior, I mean to the front part of the ear canal, which is facing towards the midline, the nose. We have a still image here of the wax. You can actually just look at it and see how dry and hard it is, and you might have seen a bit of white, a coating of white dead skin around the wax itself. Thank you for watching. I hope you enjoyed that. For anyone who's watching my YouTube channel for the first time, please do subscribe and select the bell icon, and that will notify you as and when I upload new videos. Have a great rest of the day, and I'll speak to you all soon. Thank you. Bye.